My name's Andrew. My wife Trish and I moved to the Isle of Man about 17 years ago. I'm in the finance sector, and a couple of years ago a medical condition which needed quite a bit of surgery was identified, and I found my way to the Mayo Clinic. In the spring of 2009 I'd had a pain in my abdominal region, and I went to the local hospital where they did an ultrasound scan, and they did confirm that I had gallstones, but much to my surprise, they also said that there was substantial evidence of carcinoma. That shocking news led us to approach, through some friends, the Mayo Clinic for a second opinion. We landed at Minneapolis and made our way to Rochester and found that the town was really all about the Mayo Clinic, and it put us at ease immediately. Anna, the international coordinator, met us at the hotel on the Monday morning and escorted us through a range of buildings that formed the Mayo Clinic complex. Her service was excellent in that not only did we ensure we met all of our people at the right place at the right time, but it gave us an essential backdrop to all that the Mayo Clinic can provide without us trying to learn it from pamphlets. The test battery that we went through, there were probably 20 or more tests in the first 2 or 3 days, was clear evidence of the multidisciplinary approach, the team approach that we found to be characteristic of all of our experiences. They were clearly focused on me as a patient, but working hand in glove in a way that I'd not seen before. Following the diagnosis, the conclusion of which was that radical surgery was needed, a recommendation was for chemotherapy in advance of the surgery. I was able to have the chemotherapy on the Isle of Man in the comfort of my home with my wife, and the regular reporting back to the Mayo Clinic in advance of surgery was such as to make that phase of the treatment palatable as best it can be in the circumstances. The surgery went well, and my recovery period was about 2.5 weeks. And once again, we found the quality and the standard of care, both from the nursing staff through to everybody that was involved in supporting me through my initial recovery, was once again impeccable. I really couldn't be faulted. We were really comforted by the whole solution that was provided. One of the particularly reassuring aspects of our experience with the Mayo was their care for not only the clinical diagnostic aspects of such a procedure, but also the psychological aspect of such major surgery. And not only did they worry about this from my own perspective as a patient, but they were concerned to ensure that my wife was fully involved and aware of the changes that were likely to occur or might occur as a result of the surgery. The diagnosis of cancer for anybody is a great shock. What the Mayo delivered to both my wife and I was an infrastructure of support, trust, and reassurance that will carry with us the rest of our lives. We know that it's available no matter what might befall us.